All right, everyone, let's talk about a really heartbreaking story that's been making waves in New Zealand. This isn't just another tragic incident, it's a wake-up call for our healthcare system. So picture this, a 23-month-old toddler already showing signs of something serious, but not getting the help he needed. This story is about a child who died from sepsis after being seen by multiple doctors and discharged from the hospital. That's right, multiple doctors, and yet he still didn't get the care he needed. This isn't just about one mistake, it's about a system that failed him and his family. And honestly, I think we all need to take a hard look at what went wrong here, which is extremely high for a child that age. He was also vomiting. Now, those are red flags, right? A high fever and vomiting in a toddler can be signs of something serious. The clinic called for an ambulance, which took him 2 hours to get to Gisborne Hospital's emergency department. 2 hours. That's a long time for a child who's already showing these symptoms. Now, I can only imagine the panic and fear the parents must have felt during that 2-hour drive. They're probably thinking, is my child going to be okay? What's wrong with him? Why is this taking so long? He was assessed by a pediatrician and admitted to the children's ward. But here's where things get really concerning. The family was critical that the child wasn't given higher priority for timely medical attention. And to make matters worse, no blood tests or x-rays were taken. Instead, he was discharged with a diagnosis of a viral illness. But wait, how can you just discharge a child with a high fever, vomiting, and other symptoms that could be life-threatening and say it's a viral illness? That doesn't make sense. Viral illnesses are common, yes, but when a child has a high fever, vomiting, and other symptoms like coughing and rapid breathing, shouldn't that be a cause for concern? Shouldn't that be a reason to do more tests, to check for something more serious, like sepsis or an infection that could be life-threatening? The situation got worse when the child's condition deteriorated. The mother had to drive him back to Gisborne Hospital as his situation got worse. And then, tragically, he died from sepsis shock caused by bronchopneumonia. That's the heartbreaking part. Sepsis is a serious condition that can be life-threatening if not treated quickly. But in this case, it seems like the child didn't get the timely care he needed. And that's what's so frustrating about this story. It's not just about one doctor making a mistake. It's about a system that failed him. The Health and Disability Commissioner, HDC, looked into this case and found that a locum GP and Health New Zealand Tarahidi breached the patient's rights. They also made adverse comments against another GP and a primary health organization, PHO, for their failures. The HDC report highlighted some really systemic and organizational issues that contributed to the failures. For example, there was a lack of awareness of the difficulties faced by families in remote locations. This is a really important point. If the healthcare system isn't considering the challenges that families in remote areas face, then how can they provide the care that's needed? It's not just about the doctors and nurses, it's about the entire system. It's about communication, about documentation, about making sure that every child, no matter where they live, gets the care they need, and rapid breathing, but no signs of meningitis. Despite these symptoms, he wasn't given antibiotics or further tests. That's really concerning. A high fever, cough, and rapid breathing are all symptoms that could indicate a serious infection. And in this case, it was sepsis. So why weren't antibiotics given? Why weren't further tests done? That's the part that's really hard to understand. It's like they just didn't see the signs. And that's what's so frustrating about this story. It's not just about one mistake. It's about a failure to recognize the symptoms of a potentially life-threatening condition, which prevented a full picture of the child's condition from being apparent. That's a big problem. If there's no communication between the different healthcare providers involved, then how can they provide the best care for the child? It's like they're working in silos, not sharing information, not following up. That's a big issue in healthcare, and it's something that needs to be addressed. The HDC recommended that apologies be given from Health Enzid Ter Wahwidi, the PHO, and the involved doctors, and they also called for changes to improve care for remote communities. That's a start, but it's not enough. We need to make sure that these recommendations are actually implemented. We need to make sure that healthcare providers are trained to recognize the signs of sepsis and other serious conditions. We need to make sure that families in remote areas are not left behind. We need to make sure that communication and documentation are prioritized so that every child gets the care they need. This story is a reminder of how fragile life is. It's a reminder that one mistake, one missed symptom, one failure to communicate can have devastating consequences. And that's why this story needs to be shared. It's not just about the child who died, it's about the system that failed him. It's about the families who are left behind when the healthcare system doesn't work the way it should, and it's about the need for change. What can we do? Well, first, we need to support the families who are affected by this. We need to make sure that they're not left without answers or without the support they need. We also need to hold the healthcare system accountable. We need to make sure that the recommendations from the HEC are implemented, and we need to make sure that healthcare providers are trained to recognize the signs of serious conditions like sepsis sepsis, because if we don't, then this could happen again. And that's something we can't allow to happen. This story is a heartbreaking reminder of how important it is to have a healthcare system that works for everyone, especially for the most vulnerable among us. It's a reminder that we need to be vigilant, that we need to speak up when things are wrong, and that we need to make sure that every child, no matter where they live, gets the care they need, because lives depend on it. And that's why I think this story needs to be shared. It's not just about one child, it's about the future of our healthcare system and the lives that depend on it.